She was a redhead. Gregarious, outgoing, adventurous, and smart. She did very well in school, graduated with honors, a merit scholar. She had immense amount of pain from early childhood. I don't really know where it all came from. Antidepressants numbed her, but drugs numbed her more. And so we saw a real personality shift. I unfortunately lost my daughter to a heroin overdose in 2012, and she was only 21 years old. I'll never forget the day that she died, and she just finished a semester of college. And that was the first time she'd gone back in a while. And she called to tell me that she had these really great classes, and she needed some books. And even though I knew you can't give them money, you can't give them gift cards, it's just gonna go for drug use. She says, I just need $60. Instead of going, great, let me order those books for you, I transferred money to her bank account, and she was probably dead in an hour. I said goodbye to my daughter in a body bag.
I think that the narrative that has been built in this country about what a substance user is completely false. A lot of people think that, a drug user is like a bottom of the barrel person, no education. And the bottom line is drug users are also human. They don't look a certain way. People use substances everywhere, in every community. I'm currently pursuing a master's in public health at the University of Michigan through the Department of Health Management and Policy. I identify as a recovered addict, and I have really been able to use my experiences from being a substance user to have an impact on recovery and what that means, and I try to use those experiences as much as I can to help others. It's really been embedded in everything that I do. Policy is never going to be perfect, but there's so much room for improvement, and just from some of the research I've done and the community groups that I'm involved in, we know what works and what doesn't work, and unfortunately, we're still using policies that are not effective.
So much of what we're taught about drug use and substance use disorder is harmful. Drugs are bad and bad people do drugs perspective doesn't help to understand that people are just looking for a way to cope. And we have to look at a lot of the systems that we've had historically have been about punishment. And punishment typically doesn't change behavior. Accountability is a very different perspective. And accountability can help somebody, especially early on in their recovery, because they want to change, they just don't know how. They've lived in their substance use and addiction for so long, they know how to live that life. They know what to expect from it. So when we can have people in their life to help them be accountable, whether it's taking their medication to help them with their recovery, whether it's just being able to out themselves to their struggle that they're going through, or the feelings or the emotions that they're going through, that goes so much further than trying to incarcerate it away. I know people that went to prison that didn't use drugs during prison and got out, and they went right back to what they knew because we don't have a system of support.
I've lost many people to overdoses whom I've been close to. One in particular, his drug use led him to engage in just minor criminal activity to support his habit. And ultimately, he ended up being sentenced to prison for 3 years. When he was released without any Narcan, without any really guided resources to the community, without housing, and was able to find a job, but the core of what the issue really was, which was his substance use, was never fully addressed. He never had an opportunity to work on that. And within 6 months, he overdosed and died. One of the main things we need to shift into in policy is focusing on harm reduction efforts. Obviously, the criminalization of people who use substances is not the solution. We still have overdose rates that have skyrocketed over the years. And I think that people who use substances should be treated just like anybody else who suffers from an illness. If you look at what we do know with people who suffer from cancer or diabetes, they're treated in the healthcare system. They're treated as human beings. They're not given a ticket and sentenced to jail. So I think shifting into harm reduction to help save lives and additionally incorporating more treatment resources is a key thing that we should focus on.
So syringe programs were something I had to kind of grasp around. Now it's like, it just makes so much sense. Not giving somebody access to syringes isn't going to stop their use. So let's at least try to keep them healthy. But what's more important is that it's about non-judgment. It's about compassion. And syringe programs understand that people are going to use drugs. Let's not fill them with more shame. Being able to be a person who is not a person with lived experience, to accept it, is really a big part of what we need to change. You're not just giving syringes to somebody using. No, you're helping to keep them alive. We stay connected with a lot of our participants in ways to check in on them. You know, how are they doing? What's going on? What do they need? Connecting them to resources and services and testing and treatment. And so it's about meeting people truly where they're at.
So I always kind of take it back to things we already know about, like seatbelts. That is a harm reduction tactic. Everybody is supposed to wear a seatbelt when you're driving a vehicle to, be safer in an accident. I think it's the same thing with giving somebody Narcan or allowing them to have access to syringe service programs. Those are things that can help people who are actively using substances use safely. And I know there are beliefs that that's encouraging drug use or going to increase drug use. There's no data to support that.
I think one of the most important pieces that I really want everyone to understand is that they're a human being first. Everybody comes here just wanting to be cared about and wanting to be loved. When we stigmatize their coping mechanism, we're doing harm. And to stop and take a beat, what have they been through? What can I do to support them? Because every one of those people have a story. They have something that they've been through. And then when they get mistreated because the society doesn't like to see them and doesn't understand them, we're doing harm. And yet there's a great population of people who we don't see that struggle with substance use disorder. Addiction knows no boundaries. And as long as we don't teach healthy, positive coping mechanisms, drugs and alcohol will always be there. So we have to change as a society.